But people said that this is very easier exam as compared to IELTS because they will ask the question related to your on which one is the easier to pass. Is for this PLAB exam and in yearly how many times they conduct this exam? It's an online exam where the candidate has to go to sit in this exam. So is there any fees or something we need to pay for? So hello everyone, welcome to you all in my another video, and today we are going to discuss about the PLAB exam journey. So if you are a medical doctor looking to migrate US or UK or Australia, so we provide the preparation at Academically. But today we are going to discuss with Muskan, and she recently passed this PLAB exam. So we'll see that A to Z journey about the PLAB. I will understand from her perspective how she passed this exam, what the hurdles and all those things. So welcome Muskan, how are you?
Thank you for welcoming me. I'm fine. How are you?
I'm good. Thank you so much. So here is a very beautiful weather in Sydney. Basically, I was sitting in my office. I came back, because here is a summer is ongoing in Sydney. But here the weather is like, whenever there is a hot weather, then there will be rain and then it will be very, very cool weather. This is today very nice weather.
That's amazing, actually.
Yeah, so this is very different from India. Because in India, always very hot, sometimes very cold weather. I'm from UP, so
Yeah, that's true. There are going to be extremes of weather always.
yes, so this is the advantage to live in Australia. Same like in UK as well. So, Muskan, the first question, if you can just give us like your brief introduction about yourself.
Sure. My name is Dr. Muskan Sood, and I'm a resident of Hoshiarpur in Punjab. I did my undergraduation MBBS from UP. So I started my undergraduation in 2016, passed out in 22, completed my intern by the end of 23, and right now I'm working as a doctor in a district hospital in Hoshiarpur itself. While doing my job, I was prepping for the exam, and I cleared my PLAB exam in August.
When you think that to go for PLAB or USMLE or AMC, when you decide, what are the factors basically, when were you choosing?
See, there are a lot of things, you need to take account for, because if you're going to go for the PLAB exam, it's going to be a very long journey. So you need to be very sure of the fact that you're going to settle itself in US or in UK, or, if you want to live there, or you want to just go and continue with the post-graduation and come back to India, that's going to be a whole different scenario. But you need to be really committed with the thing that you're going to take a lot of time. It's going to be different, moving from one country to another, uprooting your whole life. And if you're not sure about the decision, you shouldn't make it. And of course, post-graduation in India is becoming harder day by day. There's a lot of reservation over here. The exam is becoming tougher. It's mostly, based on your history, how much you can recall. Recall questions are a lot. But if you go for the exams like PLAB and MRCs, or if you go for AMCs also, they focus on clinical orientation. So for people like me, I guess PLAB was much easier pathway. It's going to be a long journey, but it has been my dream to, settle abroad. So it's a better one for me.
So what are the steps involved to register as a doctor or physician in UK? If you can just give us a step-by-step process to migrate.
Yeah, see, there are different processes. Like you can give the PLAB exams, or you can give the MRCs, MRCP or MRCS, depending on whether you want to go as a medicine physician, or you want to take a surgical branch. And you can also get a sponsorship from a different consultant. But I guess one of the easiest pathways, especially for those who have just completed their MBBS, it's the PLAB exam. So what happens is you need to give your PLAB exam. You need to first create a GMC account. You'll have to give one valid English requirement test, either IELTS or OET exam, depending on your choice, of course. And then you give the PLAB 1 exam. After that, you have to do the EPIC verification. You'll send your documents over there. In the meanwhile, prep for the PLAB 2 exam. And once you're done with it, you can go and register yourself.
Yes, Muskan. So first you have to pass the English test, IELTS, OET, and then you have to make your GMC account, right?
No. First, you can make a GMC account, but you won't be registered over there. You have to create a GMC account first of all.
And then EPIC verification?
No. First, when you create your GMC account, they will require which college you have done your UG from. So it needs to be registered with the World Directory of Medical Register. Yes. It needs to be affiliated with that. Yeah. So you only need your Gmail account for that, and you'll need to upload your photos, your signatures, and your primary medical qualification, of course. And then you can book your you have to give your IELTS result or your OET result. If it's within the requirements, they'll send you an email in 1 or 2 days, and then you can get seats for your PLAB 1. After PLAB 1, you can do the EPIC verification, because EPIC verification would be required later on. You can also do that after your PLAB 2, but the ideal time is between PLAB 1 and PLAB 2.
Okay, so first that GMC account you have to create. So is there any fees or something we need to pay for this account?
No, not at all. For creating the account, there's no fees, but for booking the exam, there is.
Okay, So basically, I can say like in very simple, you just need to pass the English test, whether it IELTS or OET, and then you just go for this GMC account
PLAB
create.
1 exam. Yeah,
Yeah, and then you can book your PLAB exam. Okay.
exactly.
Okay. So what is the fees for this PLAB exam, and in yearly how many times they conduct this exam? It's an online exam where the candidate has to go to sit in this exam.
Okay, so I'll give an example for India. So the exam is conducted 4 times a year. PLAB 1 exam, it's roughly around 26,000 rupees. And the PLAB 2 exam, it's a bit costlier, around 93 to 94,000 rupees. Like currently, I can see the fees is 930 pounds. So, and the visa fees and all that, that's all obviously extra. And centers, there are limited centers in India. There are about 6 centers: New Delhi, Bangalore, then there's Ahmedabad, Mumbai. The 6 centers are there. So, apart from that, you have to go to these centers. It's not an online exam, it's an offline pen and paper type of exam.
Okay, so yearly 4 times they conduct this exam, and you have to need to
Yeah,
go.
this is for PLAB 1. Yeah, for PLAB 2 you'll have to go for Manchester.
Okay, if you can talk about this PLAB 1, how many questions they ask, if you can just give us the bifurcation.
Okay,
Which
so there
subject?
are a total of 180 questions, and it's divided into, all subjects are there that you study for your MBBS. All subjects are going to be there. The extra thing that's going to be there is the ethics portion. And from what I have seen is, in every exam, one subject's going to get a higher weightage, but you'll never know which it is going to be, because when I gave the exam, the ethics portion was a bit higher. When the session before mine, in that one, they had a lot of questions from community medicine. A lot of numericals were there. Before that, there was a lot of questions from OBG. So that's not set.
This is 180 question. This is like
Yeah, 180 questions for 3 hours will be there. So basically, 1 minute for one question.
Yes, so 1 minute, one question. So it's like time management is very important.
Time management's very important because these are clinical questions. The question in itself is very big. When you read that question, it takes about 15 to 20 seconds just to read it out. So you need to be very quick in adapting to the question, understanding every bit, because you won't have time to recheck the question again.
And what are the English requirements basically for PLAB 1?
If we take IELTS, for instance, you have to get 7 bands in each and a minimum of 7.5 overall. So basically, in one or the other module, you'll have to get a 7.5 or 8, so that the average becomes 7.5. And if you take up OET, you'll have to get a B grade for the exam.
So this is we have to go for academic one or general IELTS?
No, I gave the academic IELTS.
Academic. Basically, when you are registering as a healthcare professional, you need to go for academic one, not general.
Yeah.
General one is just for the visa purpose. But if you are going,
yeah, it's for the visa purposes.
Yes,
we
yes.
have to give the academic one.
Academic one. Okay. Which one you choose, like IELTS or OET? Which
I
one?
gave IELTS actually.
Student basically always ask which one is the easier to pass. It's like, right?
See, it's not that way. You need to have a general knowledge about English as well. IELTS exam is not that difficult. You can get a 7.5 easily. But people say that OET is bit cheaper because bit easier because the questions that are asked are usually related to our medical field only. But in IELTS exam, of course, there's going to be questions from anywhere. But if you see the cost effective, IELTS cost about a half of what OET is. IELTS cost about, I guess, 17,000 and OET cost about 35,000. So yes, that's a very big difference.
But people said that this is very easier exam as compared to IELTS because they will ask the question related to your own profession.
Yeah, our field.
Yes. Okay. So Muskan, if you can just give us, you passed recently this PLAB 1. So what was your strategies to pass this exam? Like how many hours you study per day and which topic you give more weightage, and in total how many months you study for this exam?
Okay, so when I booked the exam, it was November of 22 and my date was for August of 23. I had a lot of time. I was confident that I'll do it. But there is a habit in us. We procrastinate things. I'll study an hour a day or 2 hours the next day. And sometimes I didn't study at all. But the last 3 months, I paid a lot of attention. I was working in first month I was working. So I gave like 3 to 4 or 5 hours every day. I used to be very consistent with the timings. And in the last 2 months, I quit. I actually gave a leave of absence for my work. And then I used to study about 8 to 10 hours. So I guess 3 months are sufficient if you can give time to it.
What about this PLAB 2? People said this is a very tough exam, So if you have a little bit idea, what kind of questions they ask, it's like
Yeah, so
exam.
actually it's an OSCE exam. So they're gonna be judging you. There are gonna be 16 stations. It can have a mock consultation, or there are gonna be sims can be there. You have to perform various tests. So people are a bit afraid because they haven't actually worked in the UK. They're not accustomed with what they do. What are they judging you on? Because one thing I've noticed is from my seniors and for whoever has given the exam, they said that interpersonal skills it
It's
pays a lot
yes,
of weightage.
yes, you are right.
People mostly focus on the theory, they are focusing on the diagnosis and treating, but they forget to communicate with the patients, and you are judged on that.
Yes, you are right. So I'm one of the lecturer here at University of Sydney.
Okay.
For OSCE. So in OSCE, we always see, the communication to the patient, other healthcare professionals. This is very, very important apart from your clinical knowledge.
Okay.
Yes. So this exam, Muskan, and how many times they can give in? It is going to be a UK this OSCE exam, or they can write this in India.
No, no, you have to give this exam in UK. There's a center in Manchester only, and this takes place throughout the year. I guess in a month there are like 10 dates or so are available.
So it's like whenever you are ready, you can just book and for
Yeah, you can give the exam. A lot of dates are there.
And what was the fees for PLAB 2?
It's roughly around £930.
So in approx cost, if we can just calculate like for like GMC account is free, then English, then PLAB 1 and PLAB 2, so total cost how much roughly?
See, the thing is, the PLAB exam in itself, that like 26,000 is one, 96,000 is one, 93, 94,000. Then
Yeah.
you can roughly say 1,25,000 for the PLAB exams, that 20 to 30,000 for your English requirements.
It is like
And the main cost
1.5
is
lakh.
actually, yeah, but the main cost is actually flying to UK, preparing, staying over there, the accommodations, that's going to be a huge bulk. And
Yes.
EPIC verification is also not cheap. It's about $260 for that. Then what else is there? I guess that's roughly around the charges.
Around, I can say 1.75 lakh or maybe less than 2 lakh.
Yeah, actually, if you
Around.
consider the accommodations, flying, the academies that you book,
Yes,
you can
that,
roughly say
that,
5 to 6. Yeah,
yeah, technically maybe a 6 or 7 lakh, but I'm talking
yeah,
just,
for the entire journey.
yes, like PLAB 1, English, PLAB 2, or EPIC verification. This can be done like
And yeah,
within 2
and your
lakh.
visas also. This
Yes.
is all included.
So in total, how much time will take, if someone will start journey from day one onwards?
Okay, so I started late because I didn't have seniors to guide me. But what I'll say is, when you're doing your internship, give your IELTS exam then and then itself. You
Yeah.
can give your you should book your PLAB exam during your internship. As soon as your internship is completed, when you're going through it, you can give your PLAB exam. And roughly it takes about a year or a year and a half for the entire process, because there are so less dates. I booked my dates for August and November. You can see how drastic the difference is. People are not getting seats. They're
Yes,
flying to different countries to give the exam.
I've also heard the news. It take like a 1.5 year, around 18 months.
Yeah,
There
it's
is
just to book
waiting
PLAB
period
1
is
exam.
ongoing. Yeah, PLAB 1.
I know I have friends who are going to Dubai to give the exam just because dates are not available in India.
India, yes, you are right. This is not the case in other exam like AMC. It's very
No, it's not. There you'll get the dates. Over here, PLAB 1, it's so overbooked because when we were booking, they actually sent us to a waiting room. And I could see there were like
if
25,000
someone like
people before me.
cancelled or something, then might be they will give you the consideration.
And that's a very rare chance. Very,
Yeah.
very rare, because everyone's waiting to book the exams.
This exam. Okay. Muskan, is there any, once someone pass this PLAB 2 and they are going to work as a junior medical officer or a resident medical officer, so what will the
Yeah.
salary currently? Do you have any idea?
Yeah, so it basically depends. If you're going to work as a FY2, that is foundation year 2, we shouldn't go for foundation year 1 because we have completed 1 year of internship, right? So if you go for foundation year 2, then roughly for annually you can get like £33,000.
33,000. So we can say 33 lakh basically.
33 to 40,000, it varies because different hospitals will give a different amount, right? And
Yes.
if you go into core specialty, core training or specialty training, then it becomes around £50,000 per year.
Yes. So
And
basically,
honestly, this is for a 48-hour work week.
yes. This is, I think, in Australia, mostly all healthcare professionals, they work here 38 to 40 hours only. Okay, and someone is working more than that, then they will give you like 1.5x.
Yeah, every time you'll get an extra pay. For every extra hour you work, you'll get extra pay. You work on weekends, you work the night shifts, you'll get extra.
It's not like in
And
India.
what's the best part is locum jobs are very much.
In
In
India,
India, you're not gonna get anything.
even in India, you have to work maybe 12 hours, very common. 11, 12 hour
It's
working.
very common. I used to work 36-hour shifts. It's very hard.
Yes, 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 you are right.
How can you expect a person to work 36 hours without sleeping, without, resting a bit?
Okay, Muskan, what is the process if someone want to go to UK just to do their PG, especially in the clinical subject, maybe like surgery or internal medicine or like this?
They will have to give the MRCPs. Actually, what happens is when you give the MRCP exam, you'll get into core training, and if you have valid experience, you have teaching experience, there's a point system entirely for that. You can also get into the specialty training. So what PLAB does is it puts you in the foundation year post.
Okay.
That is a post of 2 years. After that, you have to do your core training. That's of 3 years, and after that, you have to do specialty training. That's of 3 to 4 years. Depending on your branch, it's totally different. But what MRCP does it makes you skip the foundation year process. And what PLAB does is puts you in the foundation year post. Even if we do PLAB and go over there, we'll have to give the MRCs.
So I think, do you think that MRCP, and if we are someone is going for PLAB, I personally feel PLAB will be the more appropriate because they are going to work in the hospital, they are learning the things. If someone is
Yeah,
going to,
actually, you need to learn the process. It's entirely different from India. You need
yes,
to know how the hospitals work, what's going to go take place over there, and also the fact is that what we have learned in our MBBS, it's more apt to the PLAB syllabus as compared to MRCs. What I've known is people usually say that if you have completed your PG, then you should go for the MRCs pathway because then you can relate to it.
and here is a lot of different things basically. If someone, for example, death for example in hospital, so how you are informing to their
It's
maybe
totally different. The
totally
protocols are
different.
different. Ethically, it's totally different.
Yes,
You're more liable to lawsuits and everything if you don't follow by protocol.
yes,
In India, it works sometimes. Okay,
yes.
you didn't follow it. Never mind.
Yes, yes, yes. A lot of things basically differently you have to learn. So I think the PLAB route will be the more appropriate if you are working from there. So if you are planning to go abroad, you can just think when you are doing your internship and you are in your final year. You have to decide whether you want to go abroad. Then you can start
Yeah,
your process.
you make a decision in your final year and prepare accordingly.
Yes,
Because it will save a lot of time. If you are ready in your final year that I'll go for the PLAB exams, then what you do is during your internship you can clear your PLAB 1 exam, and as soon as your internship is complete you can go and apply for your PLAB 2, and there will be no time waste at all.
so what is your advice for future aspirants for PLAB, especially those are watching us in this conversation?
Okay, so if you do want to give the PLAB exam, then prepare accordingly, okay? And work hard for it. It's every journey is hard, whether in India or abroad. Every journey is hard, but if you put your whole hard work into it, then you'll surely succeed.
Thank you so much, Muskan. We will talk
Oh,
to you
welcome.
in another video. Maybe guys, please leave a comment below if you have any specific questions. So we will try to have another conversation with Muskan. Thank you so much, Muskan. Bye.
Welcome. Bye bye.